I'm Dr. Muneesh Sharma. I am the Executive Director of Imaging and Innovation at Doctors Hospital. My interest in radiology was piqued when I came to know about the technological advancements which were happening in this field in 2004, about when I was about to pursue my post-graduation. To tell you the truth, I really was interested in surgery and orthopedics, but I decided to take radiology because I saw that the future was really fast and rapidly evolving in this space. And I think I made a great decision. I love it. I think the best part of my job is to be able to work in such diverse spaces and be able to see a multitude of differential diagnoses, which keeps the interest and the excitement. Every day we come to work, we work with X-rays, ultrasound, CTs, MRIs, we do interventional procedures, we do fluoroscopy, and we are able to directly impact patient care in so many ways by being able to tell what is wrong, what is not wrong, and be able to guide the physician to offer the appropriate treatment in a timely fashion. So I think that really keeps the excitement alive. One of the common myths I think a lot of patients or even physicians may have is that we sit the whole day looking at that screen with black and white images. That's not about right, because radiology is much more diverse than that. We get to work with multiple modalities. Each of them has their own tools and special components which make it unique. And I think the active patient interaction with modalities like ultrasound and fluoroscopy, as well as interventional procedures, is the cherry on the top. So, all in all, it's very diverse, it's very dynamic, it's constantly challenging. We are working 24/7 because this is an essential service, so it's available in the nights as well. So there's a lot more to radiology than just sitting and looking at an X-ray and a black and white screen. So I think that's a common misconception. Many times patients come in for imaging and they usually want to ask about what is the exam and what should I do to prepare for this exam. But I would urge you to go a step further, and I would urge you to actually try and determine what is the machine on which the scan is being done, because many times we don't realize, but there is a diversity of tools. Let's say an X-ray or a CT scan or an ultrasound. There are many equipments which are available, and those may vary in their efficiency to determine the nuanced diagnosis. So be very vigilant. Try and determine whether or not you're getting scanned or investigated in top of the line of best equipment. It would also be very useful to know if the technologist who's working on you is experienced. Do they have the skill set or training to work on that equipment? And last but not the least, the radiologist who is reading these scans, are they experienced and trained? Do you trust them? Do you know that they are well renowned or accepted in the community amongst the other physicians? So these are some nuanced things which you really don't think much about. I think as a patient, we are kind of focused on this is my exam and this is what I'm doing. But you can dig deeper and determine more about the equipment, about the technologist, about the radiologist, because all of these diverse components come together to give you the end diagnosis.